to this motion on behalf of Legalise Cannabis Victoria. And it's been a passionate debate so far because I think we can all agree that healthcare services should be accessible, they should be safe and they should be affordable, and it's something we are clearly all in agreement on. Abortion care is healthcare, and I'm pleased to see that the government's announcement this morning is pointing more in that direction. However, access to abortion care in Victoria is not an easy thing. We are still dealing with the aftermath of a history of criminalisation, of stigma and of shame. We should not have to have this debate today, but in the wake of recent concentrated efforts to politicise access to abortion care, we are forced to speak up and to ensure that our right to body autonomy is protected. We have seen the South Australian Parliament narrowly vote down a motion to heavily reduce access to abortion care. In Queensland, their parliament is now prohibited from amending their abortion laws or expressing any view for the next 4 years. And when we look at the scenes in America, we see some of our worst fears realised. We have a duty not to be silent in the face of these attacks. Abortion access is a community responsibility. So I welcome the opportunity to contribute to this motion today. Here in Victoria, we have learnt the hard way that legalisation does not guarantee accessibility. The reality is that people face many barriers when trying to access abortion care. For those living in regional or remote communities, living with a disability or as a member of a CALD community, these barriers are even greater. When there are limited services, this also impacts the quality of care that can be provided. Where I live in the South-East, last year a woman sadly lost her life soon after accessing a surgical abortion. Harjit Kaur, a mother of two, a wife, a mother, accessed an abortion for financial reasons. Now, Harjit deserves quality, safe healthcare, and she did not deserve to die. When we have conversations about access to abortion services, people will throw around things like pro-life. But when abortion access is restricted, lives are ruined and people die. What is pro-life about that? Access to abortion services is a postcode lottery, and people living in high disadvantaged regional communities are always losing out. Travel, accommodation, time off work, caring responsibilities. These all add up and make it so much harder for people to access the care that they need. Women's Health Victoria's Realising Access, Abortion and Contraception Inequities and Enablers in Victoria highlighted that 7 out of 10 Victorian local government areas have no surgical abortion providers, and 1 in 5 have no medical abortion providers. Clearly, something needs to change. And again, I reiterate that the government's announcement this morning goes steps towards rectifying some of those issues. Yet more needs to be done. We have seen in the ACT great work in this space. They have made medical and surgical abortions free to access, and that includes for people without access to a Medicare card. But even where abortions are free, there must be health practitioners with the skills to provide them, or these changes mean nothing. There is a real and persistent shortage of GPs who provide and are trained in these services, and I appreciate Dr Mansfield's reflections on that issue. And upskilling is costly, and understandably many do not want to risk suffering the stigma often associated with offering these services. The Victorian Government must act to improve access to abortion services in our state, and they must start by listening to those in the sector about what they need. Over the summer break, my colleague Georgie Purcell and I have made a point to listen to these voices in order to understand our role in advocating for improved access to services. And I want to thank those who have already taken the time to meet with us and those who we are yet to meet with. What we've heard is that there is a real lack of local services, the cost to access and gaps in the workforce training and the need for better data collection. By understanding these barriers, we can better understand how to effect change. Fiona Patton's Health Legislation Amendment Conscientious Objection Bill in 2022 might be a good place to start. This bill dealt with taxpayer-funded hospitals refusing to offer reproductive health services and becoming a kind of corporate conscientious objector. As Ms Patton so eloquently put in her second reading speech, and I quote, "An organisation does not have a conscience, it cannot think, which means it is ideology, not conscience that is preventing access to contraception, abortion and voluntary assisted dying." Any reforms to abortion laws in this state must include the removal of the right of hospitals that receive any taxpayer funding to refuse to offer reproductive health services. This is corporate conscientious objection. Currently, public funds are being used to deny people access to essential health care. At a time when there are so few providers of abortion services in our state, the institutional denial of these services has to be stopped. When it comes to conscientious objectors, we also have a real problem with data collection. We do not know how many there are and whether they are complying with their obligation to refer patients to other providers. Despite calls from the Victorian AMA for doctors to be more upfront about their conscientious objection, we continue to hear stories of people who go to their local GP expecting a common sense conversation about their options and instead are met with judgment and silence. This forces people to have unwanted pregnancies or to have abortions much later than necessary. It is shameful that healthcare is being denied in this way. A consideration of amendments to the Victoria's Constitution is just one step in improving access to abortion services. But in the current climate, it is also an important one to safeguard access. We commend the Greens for their advocacy on this issue. Legalise Cannabis Victoria wholeheartedly supports this motion, and we call for the Victorian Government to undertake a broader suite of reforms that will improve access to abortion services, because legal does not mean accessible. Healthcare services should be accessible, safe and affordable, and abortion care is healthcare. It was the Brumby Labor government that legislated abortion access in Victoria, and it will be an Allan Labor government to protect it. Unfortunately, progress is not linear, and until we take firm action, people will continue to politicise this essential healthcare service. Thank you.